Good morning, everybody. I am Dr. Abhishek Srivastava, one of the spinal consultants in Department of Spine Surgery at Primus Super Speciality Hospital, Chanakyapuri, New Delhi. Today, I'll talk about a pediatric problem which is called as scoliosis. Scoliosis, in common terms, is called as side curve of the spine, or some people may also see it as a hump in the back. Generally, scoliosis is of two types. One is which happens to very young kids, which are less than 10 years, and we call them early onset scoliosis. And the second one, which is the more common one, happens in the adolescent age group. So first of all, I will focus on the scoliosis which comes at an early stage of life. As I have already told you, scoliosis is the S-shaped spine, that is roughly to put it, so that you understand. Also, there can be some amount of kyphosis, which can be seen as a curve, backward curvature of the spine. In early onset scoliosis, the scoliosis is diagnosed, the deformity of the back is diagnosed at a very early age, which is usually before the age of 10 years. This is also an important age when the spine is growing, the organs of the body are growing, and especially the lung is growing, because the lung can only multiply itself up to the age of 7 to 8 years. Hence, it is important to support the growth of the spine and the lungs. Normally, the myth is that we have to wait till the child grows to a full age before we intervene. However, it has changed over the years now. We have to intervene whenever we diagnose the scoliosis and try and control the curve as much as possible in a brace, or sometimes we put growth rods. We also do a technology which is called as magnetic growing rods, where the growth rods are put in, and instead of distracting them every 6 months by a small operation, we can do them as an outpatient procedure in an OPD setting. So the patient does not have to go through a small surgery for a distraction. As I have already stated, the aim of the surgery in this age group is to allow the growth of the organs and also allow the lengthening of the spine. So the most important is lung, and the lung also grows as the spine grows. Coming to the more common variety, which is called as adolescent idiopathic scoliosis. This usually happens in girls, but it is also seen in boys as well of the growing age who are adolescent. We still don't know the exact cause why it happens, and it is different from congenital or other neuromuscular curves. The main intention of treatment in this age group is to balance the spine, align the head over the pelvis, and improve the cosmesis of the back, because these kids will commonly complain that they have got a hump in the back or hump in the lower back. Whenever they bend forwards, it is more prominent. So the management is usually, you need to first see a spine surgeon who can assess what is the problem, because sometimes it can be just because of the hip problem that the problem is manifesting. If it is a two spine problem, then we have to do further tests in order to diagnose it as adolescent idiopathic scoliosis, which includes doing an MRI scan to rule out any problems in the spinal cord. Along with that, we do a CT scan as well if it is needed. Once the diagnosis is established, depending on what the size of the curve is, which we measure by the angle, we intervene. Usually the curves which are more than 45 to 50 degrees, we operate them in order to prevent the progression, balance the spine, and to improve cosmesis. The surgery usually consists of putting screws in the back. It is done from the back, and then we put rods to correct the curve. In order to complete the correction and to stay it here, the spine has to fuse. Usually the risk of minor to major complication is about 5 to 10%, and contrary to the belief, the risk of paralysis is about 1 to 2% as reported in various literature and also seen in our experience. Thank you.